Another common complaint women suffer with in pregnancy is back pain, and they also have this vague ligament pains and muscle cramps in pregnancy. Again, all these are to do with pregnancy changes. Weight of the uterus and the baby on the back is one, and bad posture is another one. So women should take precautions to keep their posture right and support their back. If they are having to work long hours sitting in, they can keep a pillow at the back, make themselves comfortable. They shouldn't bend from the waist, they should try to bend at the knees to pick up things from the floor. And some women have more ligament pains because the uterus is surrounded on all sides with the ligament supports. So as the uterus grows and it stretches the ligaments, so this leads to pain in some women because the pain threshold varies in different women. All women may not have same amount of pain, but certain aches and pains are common because of this stretch of the uterus as it grows. And few women suffer with symphysitis, that is the pubic bone pain. This is a part of pregnancy that most women suffer at this point because they can't change their posture easily on bed while sleeping or while sitting. In worst cases, we do send them for physiotherapy. They advise a certain kind of belt they can wear, like a corset, which supports this pubic bone and helps them turn and toss in the bed and for their positions. And simple painkillers like analgesia and periodic rest. That's why we tell women to rest so that all these ligaments settle down, the pain settle down. And if women don't pay attention to their fluid intake, and if they are dehydrated, that leads to muscle cramps. So the calf muscles go into spasm and they suffer with acute pain, can happen during sleep. So reasons for these cramps is either dehydration or lack of calcium or minerals like zinc. So we tell them to take calcium regularly, take milk products, drink 2 to 3 liters of water per day, and take a prenatal vitamin tablet which also has minerals in them. So with these general steps, they can overcome all these minor ailments. But in worst cases, we always tell them to see a physiotherapist who can advise them of certain exercises that can relieve them of this back pain, leg cramps, and certain exercises to overcome this symphysis pain, and wear the belt as suggested by them so that they can minimize their suffering and go through the delivery process carefully. So physiotherapist inputs are taken in women who suffer a lot of pain in spite of these general remedies. Because if you are dehydrated, especially when you are vomiting away, then your body won't get, muscles don't get hydrated well, and they also lose electrolytes in their vomiting. So the cramps are most common in excessive vomiting patients in the first 3 months itself. So cramps can happen in any stage of pregnancy. It reflects our diet and our intake of fluids, and whether we are resting enough, whether we are exercising enough, all these play a role in these cramps. No, they're not. If we follow safe principles and if they're still happening, then we need to investigate thoroughly for any underlying problems. And some women have fluid retention in their feet. Their hands get swollen up, their feet get swollen up, and sometimes they say rings don't fit or the rings are not coming out. And when they get up in the morning, their face is puffy. So fluid retention is one common physiological change in pregnancy. Just by seeing retention, one need not get worried. Only if this fluid retention is associated with high blood pressure and protein leakage in the urine, then it is a condition called preeclampsia, where women needs more close monitoring and it becomes a high risk pregnancy. Just swelling of feet with normal blood pressure, women need not worry. And they should avoid prolonged standing, prolonged sitting postures, and when they lie down, we tell them keep a pillow under your feet so that you keep your feet up. So the fluid redistributes itself and the swelling reduces. So this is the simple advice. They needn't get alarmed by seeing these swellings. Swelling is part and parcel of pregnancy because of the increased blood volume and certain physiological changes in the circulation. But they need to be mindful of their blood pressure and other changes. So if you do your regular visits for antenatal checkups, any problems can be identified and you will be alerted about it. But don't have prolonged standing or prolonged sitting. Intermittently rest is very important.